is the interface for our medical menu. At the top left, you have the tabs for the different actions that you can perform. Under those tabs, you have the actions. In the very middle of your screen, you have the patient split into 6 regions: head, torso, left and right arm, and left and right leg. The regions shaded red are areas that have some sort of injury. The darker the shade of red, the more severe the injuries are. The white regions are areas without injury. You may also see regions shaded purple. This indicates the area is in need of stitching. More on that later. Underneath the drop-down, you will see the information on the region you have selected. At the top, you have the name of the region, in this case, head, followed by whether or not there is active pain or active bleeding. Under those, you have the injuries themselves. This can include abrasions, avulsions, burns, lacerations, contusions, cuts, punctures, crush wounds, and velocity wounds, as well as how severe they are, minor, medium, or large. At the very bottom of the interface, you have the activity protocol, which acts as a log of all actions performed on a patient. Be sure to close the menu and reopen it to see any change in the injuries, activity protocol, or vital signs. For this patient, you can see there are some sorts of injuries to the head, torso, left arm, and right leg, with the torso and left arm having slightly more severe injuries. On the left side, the first tab is the Examine Patient tab, where you will find 3 options. Check Consciousness allows you to see whether or not a patient is conscious. Check Pulse allows you to manually check someone's pulse. And Check Blood Pressure allows you to manually check someone's blood pressure. At the top right, you will see a drop-down menu for the triage cards that others will be able to see in case of mass casualty incidents. Secondly, with the Basic Treatments tab, you will typically find 4 options: apply elastic bandage, apply field dressing, apply packing bandage, and apply quick clot bandage, all of which are used in your basic bleeding control. Clicking on a limb can also show you the apply tourniquet option, which you can use for major bleeding. Just be sure to take it off after the wound has been taken care of. Additionally, when the region is shaded purple, the Apply Surgical Kit option will appear, which takes a considerably long amount of time to complete compared to other bleeding control methods. This is also referred to as stitching. Next, for the Medications tab, which only appears when a limb region is selected, you will find 3 options: inject epinephrine, which is used during cardiac arrests, and both inject fentanyl and inject morphine for pain management. As EMTs, you will only be allowed to use epinephrines for cardiac arrest through the medical menu only, and not role-played through text chat. You may not use morphine or fentanyl as an EMT. Next, for the Cardiac Interventions tab, which only appears when the torso region is selected, there are 4 options: apply CPR, which performs CPR over the course of 30 seconds, apply defibrillator, which will shock a patient with no pulse, apply emergency revive kit, which should never be used for in-character situations as it fully revives a person, and finally, start ECG, which will open a monitor panel above the medical menu panel. You will be able to see the ECG rhythm at the center of the panel, as well as constantly updating pulse and blood pressure for your patient. You can also mute the sound of the ECG by pressing the volume button on the bottom left corner of the monitor panel. Next, for the Infusions tab, which only appears when a limb region is selected, you will have options for blood and propofol infusions. You may not use any of these as an EMT. These are solely to be used by paramedics and critical care paramedics. Lastly, for the Miscellaneous tab, you will see 4 options. The Carry, Put in Vehicle, and Pull out of Vehicle options do not work correctly and should never be used on anyone. The Put in Body Bag option should only be used when the patient is confirmed dead and he or she does not need to serve a hospitalization sentence for their crimes.